The A1C reduction in SGLT2 is only 0.5.
So what is the best treatment?
Only let me finish, madam. Madam,
Sorry,
I'm asking
sorry.
questions. A1C reduction is only 0.5. Then why we are overblowing this issue? Then how can a SGLT2, which is a weak diabetic drug, has become a cardiac drug overnight? It is your diuresis or your ketosis, whatever you are saying is only a hypothesis. There is no scientific evidence before it. So, for everything now, in the player goil Chundal Mari, everything don't give SGLT as the answer.
Should I say something?
Okay.
Oh, I can leave it.
It's a good leave. It's fine.
No, he asked a question also.
Chhod do? Oh.
There is no point in disputing the obstacle when it is.
Okay, madam, you had one more question?
Yes. Somebody was asking.
What is the best treatment option available for a pre-diabetic whose sugars are within normal ranges? Which drug
Guru is here.
can be best used to prevent the complications, CVD complications?
You know that number of trials have been done with lifestyle modification, metformin, and also a carbos and all that. And it has been shown, there has been a lot of push from people who have done primary prevention to see whether we can ask the FDA to actually approve metformin for pre-diabetes. But that has not been proved at all. The only place in China probably they have their carbos. So the best treatment for pre-diabetes is actually today is lifestyle modification. That's the most powerful one. But you have to do. No SGLT inhibitors. The other drug which can probably use, even though it's not approved, is metformin. Yeah. You can always use metformin because metformin is approved even for without diabetes, even PCOD. So you don't. You can always use it in patients with impaired glucose tolerance. The other drug which has been approved in pre-diabetes is actually alpha glucose inhibitor, a carbos, even in India. Yeah.
So for morbid obesity,
Obese people, the most effective thing is lose weight. But metformin can be used.
can we help them with GLP-1 receptor in that case for morbid obesity with pre-diabetes?
Okay, to some extent, yes. GLP-1 analogs has been approved in the US for use in obesity even without diabetes, so that is one option. Dose is pretty high. You know, the liraglutide dose has been 3 milligrams per day. We have used it for obesity. Of course, we always used it for with diabetes. You want to answer?
Dulaglutide, sir?
No, not really.
Okay.
Yeah, no, not approved.
I just want to say that this term pre-diabetes is something only we doctors use. When it comes to patients, they only look at it as borderline diabetes, mild, lesa, all those things. So I think the onus is on us to actually explain what is normal, what is pre-diabetes and diabetes, and there is nothing called as borderline or mild or anything, and how serious really pre-diabetes is. So if we actually sit down and empower them with that knowledge, then people take it seriously. Otherwise, it's in our busy setup and things, it's very easy to say, your sugar is a little high, be careful. So, and it just, nobody cares about it after that. So you have to use that word that, I'm so glad you brought it up, that term pre-diabetes repeatedly. Yeah.
And there's another problem in statistics. One of the reasons why drugs are not being approved for pre-diabetes is because if you take a large number of people with pre-diabetes IGT in Australia or also in the United States, there's almost 30% of them have not become diabetic over the years. So they become even normal. So on the other hand, if you take impaired glucose tolerance in India, the risk of diabetes is much higher. So treating them more aggressively is absolutely probably a little more wiser to do that because the risk of diabetes is higher with pre-diabetes if you are an ethnic background, Indian background. So in Asian population, IGT is more detrimental than IGT in the white population.
So I think we'll have rest of the questions over the dinner. We're just about to start the formal inauguration in the next hall. I request
Sure.
everybody to join there and then followed
Thank
by
you.
the dinner.
கிளம்புறேன் நான் inauguration க்கு போல